But you have to be patient obsessed in this field, because if you're not, you're going to miss something. And it's not okay to just go with the status quo sometimes and say, yeah, I could, we'll just outpatient that. Or you really sometimes have to go against the grain.
Well, yeah, and so it's no different with us. Like when we call a STEMI alert, well, we'll call that in, and then the cardiologist will come down and be like, "I don't see any elevation." Well, it's there, and I'm telling you, it's there. I can freaking see it. I know how to read an EKG. They're like,
Yeah.
"Well, I don't know if I want to do a cath." I'm like, "Look at this guy. He's pale. He's cool. He's translucent. He's diaphoretic. Classic symptoms: chest pain, shortness of breath, nauseated, vomiting." Significant cardiac history. He's already got 6 stents. Why not take him and do an exploratory cath? I guarantee you're going to find something. Sure enough, he had a widowmaker.
I want to start out with a frog in my throat. All right. Sip of water. Well, hello, I'm Nurse Dad, aka Glenn, or is it I'm Glenn, aka Nurse Dad? You pick which order. Welcome to my channel. I'm a former Navy hospital corpsman and current ER nurse. I'm excited about today's episode. I'm going to be interviewing a paramedic, a man in the field, got his grit, got his ambulance, got his skill set. Often he's alone or he's with a partner, but he is a paramedic from Missouri. Or is it Missouri? I think they say Missouri. My mom was born in Missouri. She actually grew up in 15 states, moved around quite a bit, but she was born in Missouri, the show me state. But she said people there say Missouri. I should have asked Jeff that. I wonder if he says Missouri. Yeah, I have a lot of respect for paramedics as an ER nurse. I have an affinity for paramedics and EMTs as a former Navy hospital corpsman who was treating Marines in the field. I definitely have an affinity for these types of workers. They're the first line of defense. They are the first ones who have eyes on the patients. They're the ones performing triage and stabilizing Lord knows what. And when it comes to dangerous situations or just odd situations, they're the first ones to go through it. I have a great respect to frontline workers such as paramedics, EMTs. Jeff is going to go into some of the politics behind it, some of the stripes, some of the, I guess, you can call it lateral violence that may occur between the physician and the paramedic, or the nurse and the paramedic, or even the patient and the paramedic. He's going to tell you a pretty crazy story about someone throwing fists who he was trying to help. Yeah, so stay tuned for that. As a reminder, please like, share, and subscribe and comment. It helps the channel against the algorithm. And message me, DM me, whatever they call it nowadays. Let me know who you are. Let me know if I can help you, if I can help promote you, if you have any questions. If you just want to tell me I'm doing something wrong or tell me I'm doing something right, please, I appreciate that. My handle on Instagram is nurse.dad. You can find me at mynursedad.com. That's mynursedad.com. This channel is still in its infancy, so there's a lot to be done. There's a lot I plan to do, just taking it slow, finding my voice, and getting to know all of you. Hey, I want to say congratulations to Governor Youngkin of Virginia, also Governor Morrissey of West Virginia. I'm not sure if there's other states that are doing this, but I know that these two have banned 7 synthetic food dyes from school lunches. So that's worth applauding. These are 7 synthetic food dyes in school lunches, K through 12. This isn't going to be banned from other food throughout the state. But you know what? If they want to start with the kids, I'm all for that. Of course, we need to talk about seed oils, not just in the food, but whatever they use to prepare the food and added sugar and all that stuff and ingredients. But you know what? I will start with food dyes if that's where they want to start. I am totally for that. Other states get on board. Governor Youngkin said this. He said, what we know is that these artificial food dyes, these chemicals that are injected into our food, cause problems, real problems. Now, it's kind of like one step forward, 3 steps back. Maybe that's not a fair analogy, but politicians they they go a certain distance, but they don't really get into specifics. Maybe because they also need money. But it's like, okay, they cause problems, real problems. Well, for how long has this been going on? For how long do they know they cause these problems? What are the problems? Cancer, chronic illnesses, behavioral problems? Is it the food the reason for certain problems that we're prescribing medication for, and like antipsychotic medication, or like what's going on, right? Why not a ban from all food then, right? Because what's the point of them going home being able to ingest this stuff? So they kind of go a distance, but they stop short every time. That's why we have to continue to hold them accountable. We got to continue to press them, ask those questions, and not give up. Don't just settle for a little bit. But you know what? I will applaud them. I will applaud this step. I love that we're now talking about what's in our food. It's about time. It's about time. But here's the kicker. Here's the kicker. This is where the bureaucracy comes into play. So vendors have until July 1st, 2027 to adapt the menus and sourcing. That's also 2 years where some of these nefarious players can try to work their way in, maybe get people unelected, maybe weasel their way into I don't know, getting creating a loophole. Who knows what the power of money. In my experience, sometimes the best way to get around something is to put it into law and then just create a loophole around said law. So hopefully that's not the case here. We really do have a lot of problems in this country in terms of what we're eating. Being overweight is a problem. Being obese is a problem. I'm trying to lose 20 pounds. Diabetes, we talk about diabetes like we talk about HIV now, like it's a thing you could just live with. Like, no, you don't want HIV and you don't want diabetes. I mean, statistically speaking, when you have diabetes, you can expect to live 12 to 20 years less than somebody without diabetes. And we're also not getting into quality of life, something that people don't talk about. Many diabetics are going through it in the latter part of their lives, whether they're getting sicker because your immune system is kind of shot. There's amputations you have to deal with, and we really need to have an honest conversation about this and not just say, hey, body positivity, love who you are. I mean, that is a part of it, but we really need to focus on what's happening. It's not fat shaming or bullying to approach somebody and say, listen, I've noticed A, B, and C. Is there anything I can do to help you? I mean, you literally want people to live longer and have a better quality of life. That is not fat shaming. Lieutenant Governor Winsome Earl Sears, I probably butchered that. She spoke of the science behind the legislation, citing studies from the Cleveland Clinic, Henry Ford Health Institute, the American Academy of Child and Adolescent Psychiatry, the NIH. She said these additives are not simply harmless ingredients. No, they are chemical compounds that affect learning, development, and life health outcomes. There's another word that says so much, but nothing at all. Like life health outcomes. What is that? What are we talking about? That seems like a pretty broad word. What are the specifics behind that? Physical, uh, mental, spiritual? Is it childhood cancer? Is it childhood obesity, depression, low energy? I mean, if you were to get into the specifics, I think it would rile the people up, right? If you have a company that turns out, hey, you're putting this thing in food, it's a known carcinogen, right? Like there's a reason why 30 countries won't buy our bread because we bake it in known carcinogens. I'm not even talking about the ingredients. So imagine saying that, right? Imagine calling a company out that way. Like, hey, you're putting something that causes cancer in children's food. They would never say it like that, right? Never call them out like that. No, they say stuff like life, health, outcomes. It just, it reminds me, as if I could forget, who they actually work for, because it doesn't seem like they're working for me. I want to call them out, the power of words. Imagine saying, we have conducted studies and we have traced that this ingredient or these ingredients can cause this. These are statistics of people who have been harmed under the age of 18. I mean, imagine you got specific, right, of what happens. And you put the real numbers up there. People might say, hey, look, I don't think just changing policy or changing the ingredients is enough. I think we need to prosecute some people. But they wouldn't do that. They won't do that. So again, you and me, we gotta hold them to the fire. We gotta keep asking questions. We gotta keep saying, thank you. Thank you for going a little further on this, but we got a long way to go. Yeah, yeah. Life, health, outcomes. See, I take notes. All right, but listening to myself talk for 5 minutes is about as much as I can tolerate. I bore myself. Can't hear myself talk for too long without putting myself to sleep. This is why I love interviewing people, having a conversation with people like Jeff. Without further ado, let's kick this pig. Hey, Redbeard the medic.
Hey, buddy, how's it going?
Good. Can you hear me okay? I'm using a new microphone.
Yeah, I can hear you just fine. You hear me all right?
Yeah, yeah, I hear you. Jeff, it's
Awesome.
great to meet you.
Nice to meet you too. I've been following you for a while now. I love what you're doing.
Oh, I appreciate that. I too have I noticed you on TikTok. I think it was a couple of videos where you were just stating the obvious about certain people frustrating you, and as
Yeah,
I can relate to that.
that's how it started. Like, so I posted that one video in December, I think, of just me sitting in the back of the ambulance talking about all the things that I think are wrong with EMS. And starting from
Yeah,
a provider's, really what it was is somebody that is pretty close to me ticked me off. And so I was like, listen, we got to do better, guys. You want more money? Like, this is what we got to do.
yeah. But you weren't doing it like a complaining without it an answer sort of way. Like, some people they just want to just rightfully so they voice their discontents, but then it kind of goes nowhere, or they're kind of mean about it, or whatever it is. But you're still positive. That's what I like about your channel.
Yeah, so it's more about like accountability, right? And we as healthcare providers, we hate accountability. Paramedics especially. Like we're full of ego and thinking that we know everything, and we talk about how we want better for ourselves, but then we do everything that we can to screw ourselves out of better. And so it's just one of those things where like, this is what we do to grow. And that's what my whole thing has been about this whole time is like this is what we need to do to grow. Like you want to be
Well,
recognized.
give me an example. What's something that uh, EMS might do that hurts themselves?
Just the whole condescending attitude, right? Like, and it goes from the patient to the ER staff to the people that we work with, thinking that we're better than everybody else. Case in point, there was a nurse that posted something about a negative interaction that she had with long-term care. She works in a long-term care facility, and she had a negative
Yeah.
interaction with, and like everybody jumped on the bandwagon, and I'll admit I did too. I was like, listen, that's not the way you approach this, but at the
No.
same time, we shouldn't have been that way to you. And that's one of the things that I think that just gets me the most. That we just treat people like garbage just because that they're, calling for an ambulance. And I don't understand that either.
Oh, you mean arriving to the person who called, the patient or the family, and having an attitude? Or is it because some people, I mean, let's face it, one of the, when I became being a nurse, one of the things I see when I'm driving and there's an ambulance flashing its lights, I say to myself, I wonder if that's a real emergency. And that sounds on the surface like very condescending but I don't mean it like that. But there are people, for example, who may think they're going to get seen faster by calling the ambulance. There are some people who just outright abuse the system. I remember in Queens, there was a woman. She had respiratory issues, and legit, she would come in, kind of huffing and puffing, but she would call the ambulance every day, twice a day, And sometimes if the ambulance crew came in, if she didn't like their attitude, she would send them away and then call again. 2020 hit, and we were telling her, like, listen, you really can't come here twice a day or every day. The entire emergency department is like a COVID unit now. But she did, and unfortunately, she didn't. She expired in ICU. Does that have something to do with what you're saying, or is it just people in general?
So I think that it's two sides of the same coin, right? Because I think that what happens is we get these people that we call frequent flyers, for lack of a better term, people that call for stubbed toes or
Yeah.
I've been sick for 3 weeks or
Oh,
that
I
sort of
see.
thing. We view those as like not worthy of our time.
Right.
And so that immediately gives a negative connotation to everything that you're going to run after that. Like that's a sour taste in your mouth. And so everything is based off of that one interaction. And if you're
Yeah.
not there, what happens is you become really cynical and you get jaded. And when you go to the next house, it could be somebody that's having a legit emergency, but you're not going to think so. And that's how you miss things.
That's right. Yeah, that's I've said the same thing with the emergency department. If somebody slips through the cracks because you form an opinion about everybody, you need to fix that.
And that happens more often than we care to admit. I don't think anybody likes to admit that. That's like the negative side of EMS. But working in it as long as I have, I've seen it's a tale as old as time. You get burned out, you get tired, and a lot of people are burned out to the point where they probably shouldn't even do this job anymore. But it's become a thing where it's the only thing that they have.
Yeah.
And that gets frustrating for the rest of us because like I've been doing EMS, strictly EMS, for the last 10 years. Well, actually 13, I guess, because I've been a paramedic for 10 of those. But I was a firefighter before that. So 20 years I've got on
Oh,
the job. I still love it just like I did when I started on the fire department. So,
I want to get into your history, but I just wanted to touch on some of the more immediate aspects. I mean, you guys are the Wild West of medicine. Uh, uh, I always have a special place in my heart because, like, as a Navy hospital corpsman, I was out in the field. You have what you learn from in school. You have what you learn on the job. That's mostly that's where the real learning is. What you might pick up from somebody who knows more than you might be a physician because you're in the ER, you're in the resuscitation rooms. You're going to chat with the physicians, the nurses, whoever. You're gonna get some added intel. Put that in your toolbox and use that out in the field. I mean, you really are. It's like your wits. Yeah, you want to talk about like assessing the environment. We're not just talking about walking into somebody's exam room. You're in different apartments. You could be a accident. You could be something off the side of the road. What's like a situation that you've had that you can recall where you felt in danger?
I've actually had a couple of those, but most recently, I guess it's been about a year and a half ago, maybe 2 years ago now, probably closer to two years or so. We had a call on the side of the highway for a patient with chest pain. He was in a vehicle and he was having chest pain, so they pulled over on the side of the road. This is like I want to say 4:30 in the morning or something like that. It's still dark outside. There's not a lot of traffic, so it's just like it's one of those things. So I work at a county agency, and it's a vast county. It's 837 square miles.
Yeah.
Um,
Wow. Ooh, man. Wow.
this is actually
That's
like
like
pretty
me
close
driving from New York to South Carolina. Yeah, almost. That's quite a territory.
a lot, and it's a very rural area. Luckily, this was pretty close to where we were at, so our response time wasn't bad.
Right.
Um, Kind of one of those places where like it's not in the city, but it's just barely in the county. So like whether or not you have law enforcement just depends on where it's at in relation to the lines.
And
Um,
you're in Missouri, right? Just so to clarify that. Okay.
Very rural Missouri. Like it's all farming community out here. I'm kind of in between Joplin and Kansas City.
I'm
So
picturing like a lot of roads where it's two lanes and there's this vast farmland or vacant land or wherever forest reserve just on either side. And you're just driving and driving.
Yep. That is absolutely the way that it is. We're pretty close to Kansas, so as you can imagine, there's a lot of farmland there.
Right.
Um, but this guy was in a pickup truck, and they had pulled over to the side of the road. And we got there, and he gets out, and he's like covered in sweat. You can tell that the guy does not feel well. But there are things that I have to do once I get there. Like we have to get him in the back of the ambulance, get him situated, do a 12 lead, start an IV, do all the things. And we were getting that stuff done fairly quickly. I was getting ready to get a 12 lead on him. I had my IV stuff out. And this dude just out of nowhere says that I'm not moving fast enough. He says, F you, and jumps up and goes to punch me in the face.
Oh man.
Like just so I move and he ends up hitting the side of the sidewall of the ambulance, like where we're at in the
Uh,
patient compartment. And he gets out of the truck and he goes to the ditch. Well, at this time we'd already called law enforcement. So there is a police officer, a city police officer that is sitting on the exit. He can see our lights. We're kind of off in the distance. The
right.
county, we're just inside the county. So the county officer is way on the other side of the county.
Yeah.
The city asked him, can I go handle this? He said, no, I'll get it. So by the time he gets there, which is probably 20 minutes, 25 minutes that I've been dealing with this guy, I've got this guy calmed down enough. I get him in the ambulance and we do all the things and we get him to the hospital. Well, turns out he was having an aortic dissection. So, he was having a legitimate emergency.
Yeah, that's definitely an emergency.
And it's a wonder that it didn't, completely dissect and he'd bleed out whenever he jumped up to punch me because that's a volatile situation there.
Yeah. Yeah, you get something like that, you need to not move.
Absolutely. But
Wow.
with the police officer offering to come and then the county officer saying no, I was kind of like, no, don't ever, like, we met at the ER later on. And I was like, don't ever do that to me again. Like, if you ever do that to me again, you and I are going to have a conversation, badgeless and weaponless.
Yeah. Yeah. That's another thing about you I saw from your videos. You stick up for yourself.
Absolutely. I mean, if I don't, who else is going to?
Yeah. And just for those listening, I just want to I mean I'm gonna have an introduction and on YouTube there'll be graphics appearing, but your handle on TikTok is Redbeard the Medic, right?
Yep. Redbeard the medic
That's
on all.
yeah,
I've
on
got
all.
you.
I grew my beard out to be Blackbeard the nurse, but it's mostly gray, so
There's something
Yeah.
to be said for bosses are in style.
Yeah, I was gonna shave and I'm like, nah, I'm not gonna I'll just leave it, let it go. Makes me look older. Whatever. I wish it was. I'm tempted to color it black, but I'm like, I'm just not gonna. I'm not there yet. Uh, this is a vanity question. I have to, and I want to get into your background. I just want to ask a few more questions uh, about the job. This is a vanity question, though. This is for me. You're a paramedic. You have a patient. You're taking a patient into the hospital. You're blowing by triage. You tell them what's going on. You're on your way to the resuscitation room. Say the guy has chest pain, and there you are. You're muted by the ER staff. What constitutes you saying this place really needs to get its act together? Like what is a negative encounter with an ED staff? What is happening from the doctors to the nurses to whomever that complicates this puts a bad taste in your mouth?
Well, there are a couple. So the first thing that gets me every time, and I get asked this on a regular basis by facilities everywhere, and it's why did you bring that patient here? I don't know. Maybe because the sign out front says hospital. Like if you take it to
Just correct me real quick. I don't cut you off. In New York, I know like you have to go to the nearest hospital. That's bar none. Even if you have a pediatric patient and the hospital a little further away is they specialize in that. You still got to take them to the nearest hospital. Is that how it works in Missouri?
no. So well in the city areas I can imagine so, yes. But where I'm at, like so the closest level one trauma center is an hour and a half away. The
Okay.
closest PCI capable facility is an hour away, so 45 minutes to an hour, depending on how fast my EMT can drive. Um, and so, if it's a time critical diagnosis, we absolutely have the ability to bypass the local facility because we know that they don't have PCI, we know that they don't have cardiology, they don't have any specialties whatsoever, except for
Okay.
maybe a day. And so we can bypass. And typically, I will. Like if I've got the resources to, then I will. Um,
And just to qualify that or clarify that, that's you as the paramedic making a call, a triage call based on what you're seeing. You in the field, you have your training. This is you making a judgment call.
Absolutely, absolutely.
Yeah,
You make those calls based on patient presentation, based on assessment findings. Obviously, if you have ST segment elevation on your EKG, then you have to know how to read EKGs. You have to know a little bit about neurology. You kind of have to know a little bit about all of it.
this is what
So
I'm getting into. This is why this is why it's and I like I said, I'm not bringing this back to me, but like as a Navy hospital corpsman doing a crike and doing being able to do certain things, and we're called medical technicians. As a paramedic, people have their opinions. A lot of people don't even really understand like what your skill set is, but I just want to make point out just how advanced it has to be in terms of making calls like that. Like you have to be able to read an EKG. You have to uh, be able to pick up on certain signs and symptoms that normally the physician would have to sign off on in an emergency department or a hospital. Um, this is you doing it out in the field.
absolutely,
Do you
and we
pick
don't
up
have
on this stuff, or do they actually teach you that in school?
so they teach you some of it. They teach you enough to pass the national registry test. That's really what they do.
Yeah.
They give you some of the signs and symptoms. They give you like a brief overview of anatomy and physiology. They give you like brief bullet points over pathophysiology. But then everything else that you learn beyond that comes from your own desire to go out and get that knowledge, the classes that we take, and also, when you see patients present in a certain way, like muscle memory is a hell of a thing, right? Because it'll
Yeah.
pop things back. Hey, I've seen
Yeah.
this before. I know what this is, and then you go from there.
And that just highlights the importance of. I had an instructor one time in the Navy. He said, "Perfect practice makes perfect," and it just reminds me, like when you're studying or you're doing a sim lab or whatever it is, or you're actually in the field, watching someone who knows more than you do something and teach you, like pay attention, really pay attention, really try to just soak it all up because that's where the muscle memory comes from. Like you can't half-ass your way through this stuff and then think that, oh, in a time of crisis, it's just going to be there for you. It requires a lot of work, a lot of focus, and a lot of energy.
Absolutely. This is so one of the things that happens on my TikTok is, I go live a lot, and I have all these new students that come in,
Yeah, you do.
and
You
they're
do. I got to copy you.
like,
No, I'm sorry. You have a bunch of new
so
students. I cut you off.
I have a bunch of new students, and one of the questions that they commonly ask me is, "What do I need to know if I want to get into EMS?" And the first thing I tell them is, "You are signing up for a lifetime of learning. It
Yeah.
doesn't stop when you go to class. It doesn't stop whenever you get into the field. It doesn't stop when you think that you know everything. Because if you think you know everything, you need to pack up your bags and get out of here.
Yeah, that's how you miss
It's
one. Yeah.
it's, it's all the time. You're constantly, and my wife, she's sitting over here kind of scrolling and kind of halfway listening. Um, I'm constantly reading a paper. I'm constantly reading protocols. I'm constantly refreshing my memory and trying to understand, like pathophysiology. Like I want to know that inside and
Yeah.
out, backward and forward, because that's really the basis of everything we do.
Yeah. And you don't have a team with you. You have one other person. And is it typically the paramedic and EMT? Is that the pairing?
Yeah, here it is. Some places work double medic, but I don't. I've only worked at one of those, and I've worked primarily paramedic EMTs. So
So and you're this that makes you the guy. Like if anyone's looking up someone else, it's him looking up to you, or her, she, her, or female looking up to you. You're the paramedic, so it's not like you're going to consult with them and try to. Typically, you're the one with more knowledge.
Typically, yes. I work with some really good EMTs, and I kind of try to bounce
Oh yeah,
ideas off of them. There are things that I miss. And I'm not gonna lie to you about that because I'm human, right? There are things I'll get
yeah,
tunneled on one thing, and then my partner will be like, "Hey, did you consider this?" And I'm like, "Oh, well, yeah, this does kind of present like that. Let's go down that rabbit hole. Let's see where we end up from there." So,
yeah, yeah. I want to get into your background. I just want to ask while we're on the subject of uh, paramedic EMT, if you could just briefly, for those watching or listening, what's the difference? Obviously, there is a big difference, but what is like the real difference between paramedic and EMT? What does it take to become an EMT, and then what do you have to do to become a paramedic?
so EMT is somewhere usually they're doing fast track EMT classes now, which are like 2 weeks long. I don't agree with that. Mine was a 6 month program. You did 6 months in the class, and you did, I want to say, 8 hours of clinical time in the hospital, and then 24 hours of clinical time on the ambulance. And so, as an EMT, that was what you did. You can do basic interventions. You can do supraglottic airways, oral airways, nasal, pharyngeal
Mm.
airways. You can assist with some medications, and in the National Registry, you can do CPAP as a basic as an EMT. Um, the paramedic, on the other hand, like he's got so whereas the scope of practice for EMT is fairly narrow and fairly limited, the paramedic side of the house is vast. So you do a lot more clinicals. I couldn't even tell you how many clinical hours they're requiring now, but my class was I took a certificate program, not a degree program. It was 10 months. I worked 3 jobs in the middle of all of this and still
Yeah,
managed to get all done. But you do ICU, you do cardiology, you do the cath lab. You have to follow a PIC nurse for 12 hours of the day. Um, you have to do an OB rotation. You have to do like all of these things.
yeah,
And if you do well at the end of that, and plus the internship on the ambulance, which is where you are the paramedic, you are in charge, and that's how you get signed off to go take the test at the end of the class after you pass it. But as far as the scope goes, for there are things that I can do that only doctors can do in some places. Um,
yeah.
for example, intubate. I can
No.
do surgical crike. I can do that if I can justify the need of those. I've done two. Um,
Oh, good for you.
I've done two, and it's not something that I enjoyed doing, but it was one of those where can't intubate, can't ventilate. You've got to make a decision, and you have to be able to own
Well,
that.
if you do that, then you save a life. You save the life. If you have to do a crike, there's no other way.
Absolutely. So, I mean, and there are, medications that we can give. So basically, whatever a medical director will sign off on for you for
Mm.
protocols, you can do that. You can do needle decompressions. You can do, some places are doing finger thoracostomy now. Um,
Wow.
there's a whole lot of medications that you can give without ever calling for an order for them. At my service, you can call for an order and you can heparinize somebody. So
Wow. Yeah, that's amazing. It really is. Um, you said you started out as a firefighter. How long did you do that for? Was this out of high school, or how did that?
started on the fire department the day I graduated from high school. Literally
Dang.
the day I so
What
I
attracted you
volunteered.
to that? What attracted you
It
to
was
that?
an accident. I'm going to be honest with you. Um, I wanted to go in the military, and this was, right around like 2005 ish, whenever Iraq was really heating up. And my mother, um, I told my mother I was going to go into the military, and I was like a couple of days away from signing, and she threw this big fit, like just crying and all of that. And she was like, "You're going to go over there and get yourself killed." And so we talked about it, and she was like, "I would really prefer you not go. Could you please find something else to do?" And so this was before I graduated high school. I was like, "Yeah, okay, I'll find something else." Well, my buddy got on the fire department on the volunteer side. He was like, "I think you'll really enjoy this." I'm like, man, I don't know. I don't really feel like that's, going to be my thing. Like it's hot and you get sweaty. It's not a good
Yeah, yeah,
So he's like, yeah, you go ahead and join. And I did. And let me tell you, that first fire, I fell in love with it. Yeah, it was hot, it was exhausting, but man, you really felt like you did something.
Yeah. Oh yeah. And the camaraderie and the bonds that you form. My buddy, I just interviewed him a couple of weeks ago. He's a three-time combat vet. He deployed four times. He was a Navy hospital corpsman like I was, um, attached to the Marines. And one of the things that inspired him was he lived across the street from a fire department, and he would look at these guys going there, and they were volunteers, and he was so impressed that they were just like put their lives away and do their service, and he admired that in them. Um, so you did this for how long? How long were you a firefighter?
So I was a firefighter from 2005 until 2014.
21? I didn't get that part.
2014.
2014. What made now, did you become an EMT after that, or okay?
I
What
was
made you want to switch? What was it about the medical side?
so I had become an EMT just to make myself look more marketable to the fire departments.
So a
And
firefighter EMT.
and I was full time from 2009 to 2014. I was a career firefighter. And in January of 2014, I just kind of got fed up with the politics and stuff. Like, because when you're a firefighter in a city, like especially a small municipality, like there's so much drama and politics, like between the
Yeah.
mayor's office, city council, and all of that. And so I just kind of got tired of that, and I started looking for other jobs. And it just so happened that um, a job opened up in Oklahoma, actually. So I'm from Missouri, but a job opened up in Oklahoma, and nobody around here was hiring. And so I was an EMT, and this guy came up to meet me in Joplin, Missouri, which is about 2 hours away from where I was working. And they hired me, and I got on an ambulance. And man, let me tell you, I just fell in love with it. It was the most seeing the patients and meeting them where they're at, being able to talk to people, and
Yeah.
you know it was no brainer for me because I've always connected really well with people, and I've always loved to serve, and that's the way that I've chosen to serve. So
Did you feel like there was more of a payoff in some way? I mean, putting out a fire is incredible, but was it the volume? Like you're seeing patient after patient, you're getting them to where they need to go. Did that play any part of it?
it was that, and then just understanding that there are people out there that you have no idea what they're going through, and you get
Yeah.
an opportunity for them in their time of need. And you know watching some of the older paramedics, my mentors, whenever I was coming up in the business, like, and watching how they interacted with patients and how they really did care and they were solid. Like those guys knew what they were doing.
Yeah. Yeah.
Those were the guys that like everybody looked up to. Like, hey man, can you teach me this? Can you teach me that? And I was very much that guy. Like I wanted to know
Yeah.
everything about it.
Yeah. And you want to
And
learn it. You want to learn it as you want to learn like you could teach it, right? I could see like you seem like you love to teach as well.
I do. And that's kind of the shift that I've noticed in the last few years is like I've gone from being, the guy that's like, hey, man, can you teach me that? Can you teach me that? And then now I've got students coming up to me like, hey, you're the guy. Like, will you be my mentor? And I'm like, okay, I didn't know that I made it that far, but sure.
What's a step in like a forward direction for a paramedic? Because are you always tied to an ambulance? Is there more of a teaching role, a leadership role?
So it just depends on where you're at. I do a little bit of teaching. I was teaching the EMT class at my service, part of it at least, up until like this year, and then they had some problems with the program, and it's one instructor. It's a whole deal. It's no
Right.
big deal. It is, but you can become an instructor if you like have some time on the job and you want to do something different. I'm also a supervisor at my agency. I'm a shift supervisor.
Yeah,
Um, Alternatively, you can become like a director of a service, like somebody that's in charge of the day-to-day operations, but doesn't ever have to get on an ambulance. And that might be something that I do later on, but I have no interest in that. And then alternative to that, you can go and get your critical care, your flight paramedic certification. You can go fly or do critical care training.
Yeah, does the flight have any appeal to you?
I'm currently working on flight paramedic certification as we speak. So yes,
That's awesome. That's awesome. That's something my wife won't let me do. I look because I have some experience in the air from the military, and I said to her, I think I'd be, I know I would be good at it. It seems, you kind of, because I miss that independent feeling. And nope, she was not going to have it.
I just want to. I love the critical care aspect of things, like taking these patients that are like super super sick, and like you're monitoring a bunch of drips. You've got somebody on a ventilator. You're giving vasoactive drips, right? So you're using levofed. You're
Yeah,
using pressors and stuff, and it forces you to think. I'm a thinker. I love critical thinking, so it
yeah.
appeals to my intellect, I think.
No, the things you're doing independently, like giving levofed and these are you can't for those who are not in medicine, I don't know how you can convey just how important it is. Like when you're given levo or heparin in the field to know exactly what you're doing. What's the weirdest or most unexpected thing you've encountered with a patient in a situation?
Weirdest or most unexpected?
I guess like uh, yeah, I guess like the most unexpected. Anything come to mind where you did not expect this to happen?
Um, yes. So I've had several of those calls, and I'm just like, how the hell did we end up here?
Yeah.
I had a lady get stuck in her floor one time.
Oh man.
We had to take her from her floor. She was cooking and she was naked. Um, and we had to utilize the fire department to cut around the floor
What
around
she
her.
just fell through? Is that
Fell through. It was a mobile home, and the floor was
oh okay.
soft where she stepped down, and she was a large woman, and she just got stuck in the hole of the floor. And so we had to like that was like a tactical rescue, I guess you could say, like because we had to use saws and like cut around the floor around her body so we could get her out of there.
Yeah. And then after something like that, you bring her to hospital to get evaluated?
She actually refused. She was fine. The only thing that hurt was her pride. She did
Right.
not want to go to the. This is the most embarrassing thing that's ever happened to me. Like, I don't want to go to the hospital with you. I'm like, okay, are you sure? She's like,
Yeah.
yeah, man. I'm like, okay, well, I mean, you could be hurt worse than you think, and we should probably take you. Nope, nope, I'm good. I'm good. Okay, ma'am. Understand.
What's the do you work the night shift or you work day shifts?
Both. I work a 24 hours on, 48 off rotating schedule.
24 on. Wow, that's a lot. Even if they have 2 days off, that's a lot to be that focused, be ready for those critical thinking skills for 24 hours straight. That's a long
Yes.
time. That's a long shift. What's
Yep.
your typical week look like then? Yeah, is it always 24 on, 48 off? How does that work?
So yeah, my normal shift is 24 on, 48 off, and then I will also sometimes pick up overtime, which I did this last shift. I worked at 48. So I worked my normal shift and then the next shift. So I was there for 2 days straight.
Wow.
So
What do you
it
do? What do
rotates.
you do to keep? What do you do to pick up to maintain during something like that? Is coffee like what is it?
Uh, Energy drinks. I'm a
Energy
sucker for
drink.
the energy. Yeah, caffeine, lots of caffeine.
Yeah, I have to say I'm guilty as charged with the caffeine. I know better, but nothing I can do about it. I just you can only do so much, and I think you could attest it doesn't get any easier as we get older.
Oh, it
You
doesn't.
got
It used to.
any nooks, any like like a bum shoulder and my right hip's getting kind of tight. Anything going on with that?
So I've got arthritis in my right shoulder. I've got some alignment issues in my back, and I've got a bad hip. But other than that, I'm doing pretty good.
Everything you need to get in and out of a vehicle and Render first aid on in the middle of wherever. Yeah, I got double arthritis in my feet and bone spurs from the military, so that's amazing to have as a nurse, as an ER nurse especially, because
Oh yeah, I get
sitting down, it's
it.
not not possible. I really appreciate the EMS because whenever I receive a patient, you know, say CPR is being performed, we have a device called a Lucas. You probably have something like that, right? But even if there's, especially if it's still manual, you can always tell um, most likely what the outcome is going to be based on EMS. And you know, 99.9% of the time, stellar, but just like every profession, nurses, physicians, you, sometimes a team comes in, you're just like, oh God, this is not going to work out. You know, like, you know, one of the things that aggravates me is when, again, this 99% of the time, not a factor. It's just once in a blue moon. I always hate when they're coming in with the patient, they're doing manual CPR and they're one-handing it down the hallway. I hate that. And typically the outcomes are not the greatest, but that's like my pet peeve. You know, it's like if you're not tall enough to maintain proper positioning the entire time, especially since it's so important, and it's people don't realize like CPR isn't like uh, in the movies you do CPR, they come back. It is not easy. I think like 80% of the time it isn't successful. Like it really has to be done right. And that one-handing it thing, I hate when I see that. I can imagine you encounter nurses that just make you irate. What are some negative nurse traits when you encounter those types of nurses?
Oh man. So
Come on. I don't have feel. Lay it out on me.
so whenever I'm giving like one of my biggest pet peeves is if I'm giving you a report, I'm gonna ask you first if you're ready for a report. And if you say yes, okay, because here it is. Like I don't have time to jack around. Like let's get this done. Let's get a signature. Let's get the hell out of here. One of my biggest pet peeves is when you don't listen or you ask like or bypass me and go to the patient who's unconscious asking a bunch of questions like I'm trying to talk to you here like don't turn your back on me and I had that happen a lot.
I've seen that. I've seen that where they almost treat you like you just happen to be there. And I'm always like, they're the ones that brought they know what happened on the scene. Like, talk to him. Like it's like, oh wait, thank you for the delivery. It's like he's more than a delivery guy. Like they've been treating this guy, or you know, they've been treating the patient for who knows how long. It could be up to like 40 minutes sometimes, 30 minutes. Talk to him.
Yeah, so the whole that thing that just drives me nuts. And then there's a facility that's not far from here, which just so happens to be one of our PCI capable facilities that also has an ICU. So like we have an ICU at our local facility, but we
Yeah.
don't have an intensive. We have hospitalists that work over on the ICU. And so anybody that I've intubated on the scene, and I will bypass the local facility if I can, because I know that this patient's going to need an intensivist, especially if it's like, somebody that's super, super sick, like
Yeah.
they've got respiratory failure. Like whenever I had a guy that I intubated here a while back, and his end title, it was actually a she, um, her end title was like 82 whenever I got the tube. And
Oh,
so it was raining that day and we couldn't get a helicopter, so we went ahead and transported her straight to that facility. And they asked me, well, why'd you bypass your local facility? I was like, ma'am, they don't have an ICU that's functioning. Yes, they do. No, they don't. If
yeah.
they did, taking it there. And I didn't say it like that, but I was like, no, they
Yeah.
don't. That's why and it's just drove me nuts. It's like, if you have a cat, you know what it's like when you pet a cat backwards? That is a surefire way to tick me
Yeah.
off.
Yeah.
I'm,
That's it. I like that. I like that analogy there. I'm going to steal that one.
there you go.
Uh, what about those who question why did you do that? That must happen.
It does. And usually what I will tell them is like, okay, so this is what happened on the scene. This is what it looked like whenever I got there.
Yeah.
Their 12 look like this, and this. Or like for the intubated patient, like why did you intubate that patient? Why didn't you just bag them all the way in? Well, first of all, they were unresponsive. And second, their end tidal was well above 50. So, we're presuming that they're probably in respiratory failure at this point. I
Yeah.
wouldn't want to look at what the pH was at that particular moment, but um, I just kind of try to explain to them like this is what I saw. This is the direction we went down because of this. One example that I had of that was it was actually the nurse and the doctor that questioned me. Um, and it was another one of those cases where like, why did you bring that person here?
Hmm.
So I had a blind patient that was backed into in a parking lot.
Hmm.
He fell, hit his head. He lost consciousness, kind of seized a little bit. Um, when we got there, he was adamant he was not going to a more distant facility. He's like, I'm not going to the trauma center. Like, I'm not going to mention its name, but that's what he said. I'm not
Yeah.
going. I will go to the local facility. I will go here, or I'm going to refuse. And I was like, well, sir, we really need to go to this other facility because you've had a significant traumatic event, and I'm afraid that you might have a head bleed
Yeah.
and possibly fracture and possibly everything else. He's like, nope, I won't do that. How am I going to get home if they discharge me? Like,
Right.
well, that's a reasonable concern, but we really need to bypass this facility. He was like, nope, I'm not doing it. I'm going to do that. I'm going to go here. I'm going to refuse. And so we transported him to the local facility. I collared him and stuff, reassessed him, neuro checks. He was kind of altered a little bit, had some blood coming from his mouth.
Oh
And
man.
I called and I told him, I was like, this is a level one trauma. However, the patient refuses transport to the more distant trauma facility, advising he will only come here or he will refuse. They copy my report on the radio. We get there, and this nurse is like, you didn't tell me all of that. I was like, ma'am, you literally copied my report. And the person that took the report wrote it down. So if they didn't pass that along to you, I don't know what to tell you.
Yeah.
I told you everything that was going on. And she was like, no, you didn't. And the doctor was like, this is what he said, and I quote, you're an idiot for bringing this here.
Wow.
I was like, so doc, do you prefer? And I did get mad there, and I was like, and I did not handle it appropriately. I will admit that. Forgive me for
Hey,
not handling.
sometimes they're asking for it.
I looked at the doc and I was like, and what the hell would you have me do? Have him refuse? Have him refuse and go home and die? No, I'm not going to have that on my conscience. If you want to
Yeah.
discharge him, you go.
Yeah.
Well, he ended up having a basilar skull fracture and a subarachnoid bleed. Um,
Oh. What are they
so
doing in there to
they,
transfer him somewhere else then, right?
yep, so normally they would have called us because it's a 30-minute transport from that facility to the more distant facility that I wanted to take it to. Actually, probably closer to like 15 minutes, I guess, from there.
Yeah.
But instead of calling us, they called a helicopter to respond 4 minutes away, a 4 minute flight, to transport back 4 minutes away because they were being petty.
Hmm. Man.
I didn't last long at that service, as you can imagine.
Yeah, and this whole time you're advocating to a patient who's refusing against their better judgment. Just to point that out, like the seed of all this frustration was you're trying to do the right thing by the patient. The patient won't let you do it.
Yeah, absolutely. And then the doctor gives you crap for it. It's like damned if
Then a
you do and
domino
damned.
effect.
Yeah.
Yeah.
So
Does
frustrating.
that does that happen often or
No,
really?
not usually. Not here anyway. Not at this local facility that we have here because I have a really good rapport there. Um, the nurses there, they all know me. The doctors, they all know me. They know the kind of care that I provide. Um, some of the more distant facilities, maybe I have that, every 4 or 5 times. There is one facility that my partner knows that if we go into that facility, that her goal is to get me in there and out of there as quickly as possible because somebody's going to piss me off and somebody's going to get a piece of my mind.
Yeah.
So what happened.
How's your administration with backing you up? I mean, all this stuff you have to document it. I would do you document it like you have a tablet with you, or you go back to the HQ, or uh, there's written, and then if something like that happens, how does that work in terms of informing your supervisors so that they're aware, and how does that work? How do you protect yourself?
So where I'm at now is really, really good about that. I will tell you that not everywhere have I had the same experience. There are other people, other places that would throw you under the bus faster than anything. They throw you under the bus, let that
Yeah,
facility run over you, back over you, and then run over you again. Um, my boss is fantastic. The assistant director, she's fantastic. They are really good about backing us up, especially if we can justify why we were in the right and why the interaction went south. Um,
right.
even there at that previous service, like the medical director was who stood up for me because they called me like it's a corporate EMS system, and they called me and the medical director was like, "So what happened?" And I explained it to him, and I said, "And I know this kind of stuff happens. You know, it's a part of the job." He said, "Not anymore. It's not." He said, "That is not a part of your job. You don't have to take
Yeah,
that from anybody."
yeah,
He
that's
called
great.
them on and them apologized to me.
Yeah, it stinks that even as a nurse, I always feel like you could be the fall guy. You just know that if a patient wants to bring up a lawsuit even down the line, they're going to comb over the entire medical record, and it's like shit rolls downhill. The physician could do something, but it's the nurse can get the nurse is more easily dispensable. Let's just say, it's even in terms of violence. I know of a nurse. This is on my last podcast. I was speaking to a nurse practitioner about this, but uh, this guy was getting beaten up, and he kind of threw a punch to get away from the person, ran away, and was fired for that. It just seems like across the board, it's very hard to be able to count that no matter what happens, they've got your back. I once did a contract at a level one, and the patient was in the hallway because, well, that like, we give patient rooms, but if they don't need them, they come out and they're in the hallway. He didn't like that, and he was also a patient that required a little extra help, so we'd have to find like an area to do that, to give him some privacy. And I think it was the nursing assistant that took him into a room, and he had just been so fed up with like going into the room, coming back into the out in the hallway, that he accused the nursing assistant and myself of abusing him. And the moment the what he had pointed out was a particular moment, but it was in the hallway, so there were cameras in the hallway. But regardless of that, I was taken off my shift. I had to talk to police officers. The manager had to look at the tapes, and then they would discuss it with me the next day. And the next day rolled around, and she's like, "Well, thank you for everything you said. Turned out to be true." And I'm like, "Well, of course it was true." But like there was a moment there where it was like, wow, if he wasn't in the hallway and was in a room and just said whatever, I would have been fired, and that would have stuck with me. But so I'm really glad that you have uh, people, leaders who will back you up. It's just such a shame that it depends on the person for whom you're working, and it's not the system that has protections for nurses or for paramedics, and you're kind of like on your own.
Yeah, it's unfortunate, but that is one of the many things that I believe is broken about the healthcare system, right? We are, and unfortunately, we live in a very litigious society. We do. I
Yeah,
mean, we people are going to sue you for whatever they can think they can get a buck out of. And
yeah,
if you think the company is going to have your best interest at heart, no, absolutely not. You better have a good attorney because they'll throw you to the wolves most of the time.
yeah,
And that's
yeah. Every nurse should on their own get their liability insurance. Do you have that in the field? What's
we
That's
can
one of
get
the things I did.
We can get that independently. I have not yet. I'm currently working on that. It's just an expenditure that I can't afford to make at the moment. But I definitely, absolutely am going to get that in the near future. I had a quote uh, done up here a couple of weeks ago, so that's my next step.
All right. And for all you nurses watching, I'll put a link below of who I use for liability insurance. But yeah, it just frightens me. It's like 'cause you just know, man, if something happens, they're gonna you just the nurse, you just can't escape. They want to. That's why I document for the lawyers. I document typically the things that can most harm the patient are the things that, if not fulfilled, can jeopardize your license. So that's the kind of an easy way to when you're a novice nurse. I always say, like, think about that. You have a hypotensive patient, you come on duty, but the vital signs weren't done for 6 hours. They're here for hypotension, and there's no blood pressure in the computer. You want to get on that because if that hurts the patient, and that'll hurt your standing. So that's how I teach. I'm always like, document specific. Nothing general. Patient was aggressive. How are they aggressive? They were verbally threatening. What did they say? So protect yourself because you could be on your own. Now, I came up with all these questions myself, but I used AI for one for AI gave me a list of 10 questions, and there's only one that I want to ask. Have you ever delivered a baby in the ambulance?
I have delivered two in the ambulance and one in somebody's living room. So yes,
Did you
I've
say two
delivered
in the ambulance? You said two
two in the ambulance. Yes.
and one in the living room. When I was in Navy Hospital Corps, I think we had like the one class on it. All I can remember is you got to massage the fundus. If you're delivering a baby, afterwards you gotta massage um because of the bleeding. That's all I remember. But that's amazing. Were they pretty clear, like pretty clean?
The two in the ambulance were the one in the living room was not
Uh,
because I had to call for another ambulance because the mother had a placental abruption, and that was my very first delivery ever.
wait, she had an abruption. Wow. And
Yeah.
for people not in the medical field, just explain what that is.
So so it's basically she's got massive bleeding
Yeah,
because the
massive
placenta
bleeding.
not it's like just it's painful bleeding, right? So
Yeah,
like we've always said that like placenta previa is not not painful. Like there's bleeding, but it's not massive like this. This is
yeah,
massive hemorrhaging.
yeah,
This is one
massive
of those
hemorrhage.
you really hope that you have TXA for, um, and even then, is it really going to help? Um, what they
Yeah,
need are is
abruption can be. Yeah, I mean, previa is one thing, but abruption that's like that could be a very negative outcome very quickly. How did you handle that in the living room?
uh, load and go, very very fast load and go. Fluids, bilateral lines. This was before we were doing a lot with like Levofed and vasopressors. Otherwise, I probably would have given, and we didn't even have TXA at that service, so I probably would have given TXA if I could have. But it was mostly just fluid resuscitation, basically.
How often you have to utilize IOs?
Uh, Quite a bit actually. Most of the time we'll utilize that. Usually, where you'll see that is in cardiac arrest. However, if you can't get it, and if you can't get access, and the patient needs access, like you know, quick, fast, and in a hurry,
Mhm.
sometimes you're going to have to use the IO on a conscious patient. So for that, we give them a little bit of lidocaine to kind of because it's not using the IO that's the problem. It's not starting it; it's using it. It's like giving medications and things through it.
Yeah,
So quite a bit, quite a bit. I use it quite a bit. I'm also a black
yeah. It is.
cloud
It is a
nurse.
good. It's a nice go-to in a pinch. Like I said, I've noticed that people over the last 5 years, my IV game is good. I'm pretty happy with it, but I have noticed objectively people people have been tougher sticks. I don't know what it is. I feel like they're heavier, or They're they got other issues, or they're more dehydrated, or people just getting older. I feel like I've been more challenged as the years have gone on by with the IV game.
My Ivy game's pretty good too. However, there's times when I couldn't hit the broadside of a barn with a baseball bat, and I'll go two and three patients like that. I'm like, what is going on? I've
Yeah,
not
there
changed
are
any.
days. Yeah.
Like I'm doing the same thing every time, and it's not working.
Then there's days where you feel like you could do a blindfolded. You just feel like the man.
Engage from across the room. Yep, got it.
Yeah, I know, right? Like a dart. Look at that skill. Um, is there anything I haven't hit that you really wanted to uh wanted me to mention?
So not exactly. I do want to say that I think that the animosity between nursing and EMS is an issue, and I see it all the time. It's like one thinks they're better than the other, and it's on both sides. I'm not going to say that it's on one side or another because it's on both sides. Like you know, we fail to realize that we are all in the same job together. We're doing the same thing, and we are on the same team.
Yeah,
And this is
that's worth noting.
this stuff right here, what we're doing, having an open and honest conversation. This is how we get better about it. This is how we come to an understanding about what it is that each other does.
Mhm.
So I'm all about these opportunities.
Yeah, I always get along great with paramedics, EMTs, perhaps because I feel a little bit of a kinship from having been a corpsman. But thank God, like I said, you can, let's just say, it gives me a lot more hope in a recess room or a trauma room when EMS comes in and they are on top of it. It's just, it's a great way to start. It's just a great energy. Especially, I love it when they stay. You'll see them just stay and watch, and I love it. I love a great team. I really do, and it takes a team. I mean, they say it takes a village to, raise your kids. It takes a little mini village to guarantee a positive outcome. And even after the ER, obviously, before the ER, after the ER. But yeah, I love it when EMS comes in because I get kind of a refresher too. Just the energy and just that assessment in the field. Uh, I enjoy hearing it. It just I think what you're doing is it is the first line of defense against whatever is ailing somebody, whatever brings somebody down. It's so important. I mean, they say like the golden hour, in some cases it's the golden minute, and it starts with you. You're the one that puts that tourniquet on. You're the one, the doctors can order whatever they want once they receive the patient, but it's your judgment call. You're giving fluids. Oh, it's a head injury. Let me not give too much, or does this person a CHF, or it's your first assessment, your finger stick. Is it hypoglycemia? Like, what is going on? And it's just not to be underestimated.
I appreciate that. What we do is, I think that there's such a disconnect between the healthcare system and understanding what it is that we do, because so many people view us as, just a transport entity. And, yes, we do fall under the Department of Transportation, but that was by necessity in 1968, 1971. Um, you know, and there's so much more that we do. I mean, shoot, we've got pre-hospital services that are recognizing and treating sepsis in the field. We've got pre-hospital services that are giving whole blood now. We've got
Yeah,
point of
wow.
care we're working on. We've got, point of care ABGs that we can do. It's insane that the expansion of the scope of practice over the last 50 years.
Yeah.
And it's only going to get better.
Do you have any predictions how AI might affect the future of a paramedic EMTs?
I think that it will probably be used as a really good assessment tool. You plug a bunch of symptoms into with the AI, and the AI is like, okay, well, this is what it looks like from here. Obviously,
Yeah.
you're going to base a lot of your clinical judgment on what you see, but at the same time, AIs are going to be a really good tool, and hopefully, it's really good at like writing a chart for me, so I don't have to chart anymore.
I know. I know. I know you talk about, litigious society. I feel it's oh my God, just the button clicking and the check marks, and you just know it's like lawyer, lawyer, lawyer. That's all it's for. It has nothing to even do with the patient. I could just do a narrative note that would encompass everything, but before you can even get to what's going on with the patient, it's like all these little questions, and uh, yeah, if they could, if program could do that, that'd be great. Do you typically work with the same EMT? Do you try to adjust your schedules to work with each other?
No, we the way we operate is it's kind of like a fire department. We have an A, B, and C shift. So A shift is the same all the time. B shift is the same all the time. C shift is the same all the time. Unless we have a part-timer working and then I can adjust as need be. Being the supervisor, I get that luxury. Like if I have somebody that I don't really care to work with, and there are a few, I'm not gonna lie to you, I will kind of like, alternate who I work with, but typically I work with the same partner all the time.
And uh, is he a lot younger than you, or what's that dynamic like?
He is actually a year older than me.
Okay.
Um, he went through the EMT class 2 years ago. So the story is like she got hired full time. I left and I came back. I went to that other service that I was talking about with the guy with the head injury and stuff.
Yeah.
And what I found out was the grass wasn't greener on the other side, so I came back home to this service, and then I got put back on the ship with them, and I was like, okay, so you're gonna be my partner if that's okay, because they made me the supervisor pretty well immediately because I knew her because I taught a lot of her EMT class.
Okay.
Um,
Right, 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 right. You're in that phase now where you might see your own students.
and so she actually almost quit. She had a bad experience with one of her preceptors, and was in picking up something, and I said, um, like, what? I think I asked her how it was going. She said, "It's not good. I'm going to quit. I'm going home." I was like, "No, you're not. Like, you're absolutely not going to quit. Like, you're going to finish this out. Like, you're going to get a job here." She's like, "I don't know about that." And sure enough, a few years later, here we are. She's my partner now.
It sounds like in your world, just like in mine, burnout, compassion fatigue, this is just as relevant, just as prevalent. That's the word I wanted to use. Um, yeah, so I know now it's like I feel like there's like it's always either new grads or older nurses like me. There's like not many in between. What have you seen? Is there a shelf life to a certain, if you have five new people, do you expect that maybe two won't make it? How's that?
Yeah, so I want to say for every four people, maybe two will last. I make a joke whenever we get a new person, like, listen, I'm probably not going to remember your name until you're here for at least 6 months. Um, I do, but it's just it's my joking way of saying, hey, I really hope you stick it out.
Yeah,
Um, I find that the money's not what they think it's going to be. They have to work a bunch of overtime to make a living. But at the end of the day, what you find out is that you decide how much money you're willing to accept. You accepted a job, and if it's not enough for you, that's fine. Go find something else, and you totally understand that.
yeah.
But so for like paramedics, for example, the average career expectancy for a paramedic these days is 5 years. Only 5.
That's how long the average lasts. Sorry, the last part I didn't hear. Okay, wow. Yeah, I mean it's not so great on the nurse front either. When you look at the statistics, I don't have them off the top of my head, but it's really kind of uncanny just how many people change their careers, especially after they've invested all the time and money into it. I think maybe people get caught up in the individual, like maybe I guess especially for your field, it seems very like a frontier, like you're a frontiersman. You're out there, you got your wits, you're with your partner. Maybe people don't realize like this is a lot of work, and you're also going to see some pretty not just tragic things, but things that really aggravate you as well. Like there, you're gonna the whole spectrum of emotion. I think nurses like I feel like a lot of people think like, oh, I was a great babysitter or I'm great with people and I'm going to be a nurse. And I'm like, I feel you feel more like a police officer than a nurse most of the time in the emergency department. The things that you're seeing, the things you're encountering, I half the time I don't feel like a caretaker. Half the time I'm kind of just trying to like you with that patient. You want them to go somewhere, or you're trying to do what's best for them, and you're getting resistance from it. It's like you're just trying to do your job. You're fighting to do your job, and I think a lot of people get burnt out with that.
They do, and they also get burned out with the fact that you can watch any TV show, and they're making these big freaking rescues, and they're saving lives every time, and they're doing CPR on people, and people are coming back. But what they don't show you is how often it doesn't work, how often there is a negative outcome. And I think that the new people get into it with the best of intentions, but there's this illusion that they're going to save lives every single day. And sometimes the way that you save lives isn't the way that they portray it on TV. Sometimes it's by hanging out with a person that's an addict. It's
Yeah,
by, talking to them, knowing the resources, trying to get them into a rehab facility, trying to get them, help. It's holding on to a little old lady's hand when she asks you to hold her hand, because why wouldn't you? Like, that's the human thing to do.
yeah.
But they don't stick around to see the good, and it's sad, but it's true.
It reminds me of how they were saying because of you know that show like NCIS and all these crime dramas where the evidence is so conclusive. Like in real life, people on juries are they're hearing the evidence or seeing the evidence and they're not. Uh, it's not like on television where it's cut and dry. I remember I forget what article it was. They're just where this just television and social media is kind of warping people's expectations of things. People ask me, or people say to me, "Oh, I don't like. I can never be a nurse. I don't like blood." And I tell them, I ask them, "Well, how do you feel about piss and shit?" Because because blood isn't that bad, all right. It's- don't mind me. I'm pretty curt. But yeah, it's just I don't think people realize just um, what it's like to take care of people or respond to people in distress. Um, Even as a firefighter, I'm sure you saw that reality, right? It's not rescuing people from a building every day.
Sometimes it's rescuing a cat out of a tree and then getting in trouble for it.
Yeah. Well, you were
And
saying with, um, you were saying with like early in the podcast about judgment calls or constantly learning. A lot of times it might be, this person is exhibiting these typical symptoms, but I don't think it's this. I mean, that could be the difference between life or death, and it's very subtle.
absolutely. And you have to plan for that. Like, you have to be willing to look for those things. Like, we have a saying in this job, especially like whenever it comes to like EKG interpretation and trauma and things like that. If you hear hoofbeats, don't go looking for zebras, because it's probably just horses. When you see a zebra, that's going to make it stick out all the more.
Yeah.
So
Yeah, I got that early in my career. I saw it was actually in the Navy. I saw a physician had made the wrong call. There was pneumonia season. They thought the patient had pneumonia. Even I, at that time, I was fresh out of A school. I was brand new, and I remember even saying to myself, it wasn't my patient, but I remember saying like, he's got the crazy photophobia. His eyes are kind of sunken. He's very pale. It just was not jiving with me. And it turned out, he had something where the symptoms were very pneumonia-like, but he didn't make it. And I would never want to live with myself if I assumed. And I also, I mean, it's probably, um, I try to treat every patient like my mother. I mean, it doesn't always happen, but it just reminds me that if you were looking at your mom going through something, would you make any assumption? You would comb the surface for any little, like you were saying, like the zebra or anything that was abnormal. You'd be looking for everything. That's just something, I always say. Um, and that could be the dip. That's not very it doesn't that might not look great on TV, but that makes the difference.
Absolutely, absolutely. So there's something that I tell all of the people that like get onto my TikToks and things like that. Like, if you are a clinician and you are operating in a clinical capacity, excuse me, you have to operate under several differential diagnoses and then narrow them down based on your assessment findings.
Yeah,
That's where good skill comes in right there, is being able to recognize those cues that what you think is the problem may not be the problem, and maybe it's something much easier to handle or much worse to handle, much more difficult to handle. And you have to prepare for those things. If you don't like seek that knowledge and you think you go into that without, or you're less than compassionate about it, like, ah, whatever. Same symptoms, different day. Patient's been sick for 3 weeks. So I'm not going to treat them the
yeah,
same as I do. And you're wrong. Oh my, because you
yeah,
just screwed up life forever.
yeah. That's something you don't want on your conscience. I got a taste of actually early in my career of thinking outside the box and using critical thinking and you know unmasking what was really going on. And once that happened, I said, this is what medicine feels like for me. This is what it's all about. Because yeah, you might treat 50 people and 49 are just, it's kind of like just going on routine, but it's just that one person. uh, you don't want that one person to die on you because you just doing the same old thing. You have to really go into each patient and really look for evidence that perhaps things are not what they seem. I know it's 9:15. I don't want to keep you on too late. Thanks for being a good sport, Jeff.
I absolutely enjoy these conversations. This is one of my favorite things to do. I love talking the job.
I know you do. I know. Let me get into that. What made you start to, go on TikTok and make videos?
It's knowing that, people are actually getting something out of what I'm doing. Because yes, I'm an educator. I love to be an educator. I love to teach because I think that I have a different perspective. For a guy that's been on the job as long as I have, I still love it with all of my heart and not be upset about having to go to work every day and, not being upset about having to go into patients' homes and all of that. I think that, that's something that's unique to me and to a few others because we really do want to see EMS improve. I want to leave EMS better than I found it. That's the goal. So we get to celebrate people's successes, right? Whenever they've asked you for, assistance passing the national registry, or they've asked you, for what to expect whenever they do a clinical, and then they go to their clinical site and they have the best time. They're like, "Thank you for the advice. Like, I followed your advice and I passed," or, and one of the things that we try to do is to, celebrate those things. Like when people come into the live, I had somebody today come into the live and say, "Hey, I just got my score back from the National Registry and I passed." And so everybody in the live, I'm like, congratulate them because they just did something that is fantastic. Like you need to recognize them. And it was
Yeah,
good. It makes
it's nice using social media that rightfully so has a lot of negative uh, opinions, have cultivated a lot of negative opinions. It's nice to take it and use it in such a positive way because it really can connect people to each other. One of the things I struggle with is I don't want to resort to those easy tactics for views. I prefer to have substance. I prefer to just not be so gimmicky. So I know I'm still trying to find my voice with the channel. The algorithm is a beast. It really does decide what it wants to promote. and that's tough. That's tough. Uh, yeah, but no, I really like what you put out there.
It's been enjoyable. I have met so many great people over the course of the time that I've been doing the TikTok thing. Um, I just actually met one of my fellow creators, and he's kind of getting finally getting his feet underneath him and getting a following. Nightmare Medic. He's out of Iowa, and he was passing through, and we got to have lunch together the other day. So
That's
I've got
cool.
opportunity network with people that I never thought that I would get to network with. I mean, I was on EMS Avengers podcast for a few minutes the other day. So, uh, and if you know anything about EMS Avenger, you know that he's one of the bigger creators on the platform. So,
Yeah, yeah, yeah.
uh,
And hopefully you don't
it
have
was
someone outside your window who saw you in those TikToks and yeah, stalking outside the house there. What you had said, doing this because it seems to be helping people. I had a experience the other day where somebody had commented on a video I did with a domestic abuse survivor, and she had to flee to a state with her kids, and she had to research the actual state that would give her the I didn't know this that depending on what state, a woman who's fleeing with her children has different levels of protection. I mean, I guess I should have known. I didn't know it to the degree that she had voiced it. And someone had commented, I did what she did. I left and I took my, I left to that, I fled to that state for that protection based on the video. Like that's pretty amazing. Yeah, I was really, really touched by that. So like that's part of the reason why I do this. And it is nice to get that information out there. I feel like we're entering a new age with this. We probably haven't even touched the surface. I feel like I think I read somewhere people are going to pick their own celebrities. People are going to make their own news. I mean, that part sounds kind of um, questionable, but I think I've watched so many videos by people who really put in the work to be objective and um, uh, invite other people in for a conversation that is way better than anything I've ever seen on television. And it seems like um, there's a push, I think, that people are going to use this platform to bypass all the propaganda that they might be seeing or the half truths. I think a lot of young people they come on here to look at people like you. Like, I want to be a paramedic, and they'll get more out of listening to you, watching one of your videos, than all the things that they could find online on websites to read about, because they know like this guy is actually talking from experience and objectively. So yeah, that's
for me, the way that I've always viewed it is I'm not going to bullshit you. I don't have any reason to bullshit you to get, you to come to our line of work. I'm going to give you the raw, bare bones, nitty gritty. This is how it is out here. You're signing up for a lot of things, and it's one of those things where you have to have a certain mindset to thrive in it, or you have
yeah.
to be able to develop it to thrive in it. And I'm
You're
not going to
helping them
put people.
create a yeah, you're helping them create a baseline. It's like you had just said, being stressed out or upset that you have to even get up and go to work. Like people don't realize like enough time goes by, you almost resent the fact that you got to keep getting up to do this thing, right? I had made a video about, we always talk about our goals and what we want to do. Like make sure you pick a career where the problems that come with that career, you want those problems because then they gnaw on you after a while. They might just be background noise when you first become like a paramedic or a nurse, like the things that are frustrating you about the profession. But enough time goes by, it's like it's like a bullhorn. So make sure those are problems you want to have.
That is true. I know many paramedics that get up every day and they feel like they're miserable. They feel like they're stuck in this rut. And it goes back to, them not having anything else. Like this is what they've done their whole career and they don't want to do it anymore, but they don't have any other skills. And then there's me. And I still absolutely get up every day with the intention of doing my best 100% of the time. And what that does is it sets sometimes this, mindset in me that I have high standards for everybody because I also have high standards for myself. And not everybody is going to operate to my standards, and I know that. Sometimes I can't even meet my own standards, but I try.
Yeah.
Every day I'm trying to do my best.
Aim above the mark to hit the mark. That's what I say. I have two questions for you, and I'm going to let you go. Do you think part of it is the financial pinch that we all feel? I have met more nurses. I've never met more nurses that work 4 days a week, even 5 days a week, and those are 12-hour shifts. Or they have a staff job that's full time and they're doing local traveling. And like, I mean, I don't think people can really understand just how much this business takes from you. It's so exhausting. So for more and more people to work, like I said, a nurse working 5 12-hour shifts, it's really like kind of 13-hour shifts. You were saying you were talking about picking up overtime. Do you think part of the discontent is having to work so much, or the money just isn't what it used to be, isn't as valuable as it used to be? Do you think it's partly that we're seeing?
Oh yeah, absolutely. I think that that's one of the bigger ones. There are a lot of people that'll tell you we don't do this for the money. Bullshit. That's
Yeah.
that's complete bullshit.
I, when people say that, I'm like, so you telling me if a doctor got a nursing salary instead of a doctor's salary, you'd still be a doctor? Come on, let's get real now. If a nurse got
No.
paid as much as a nursing assistant, would you be a nurse? It's like, yeah, I hate when people talk like it's a career. And it's important too that people know it's a career. So we should be getting certain protections should be in place, certain benefits should be in place, shouldn't be treated like we're so disposable. It is a career, and it's almost like it's like the master. Let's go back to like 19th century Russia, where like you're a serf. It's like the landlord is telling you you're so special, you're so good, you know, just so you get out there and you put in your work with no shoes on and no heat in your house, just so like you take it, like this filling your head with this fluff. Like what you do is so great, and it's like it comes from the heart and it's who you are, almost like so they don't have to pay you your worth.
Absolutely. Yeah. That's so we have a running joke, and I know he doesn't whenever he puts it out there, he doesn't mean it like that. But it's just one of those things that, my boss always at the end of his messages up until just recently would put thank you for all you do for the district. Which, and I know it comes from a place where he really does care and he really does mean thank you for what you do for us.
Yeah.
But it's at the same time, it almost sounds like, okay, well, I'm not paying you any money, but here's a pat on the head. Thanks, good sir. Now get back out there and do the Lord's work. God bless you.
It's like,
You know?
don't get me wrong. I want to do good out there. I do operate. Uh, if I care very much, but when I read an article from the Yale School of Medicine that says that the 88 large healthcare companies, 95% of their net income went to stockholder payouts. And so everything that we know about medicine, at least in terms of these 88 large companies, is really just we're just watching 5% of the budget at work, whether it's to pay our salaries, the equipment, deal with patients. It's like don't feed me that bunk about doing this, from the goodness of my heart. It's like I know that you're not spending enough. You talk about nurse shortages. I know it's because you're just not hiring enough nurses. There's plenty of nurses out there. You're just not hiring enough nurses. But yeah, it's a duplicitous thing because you are there, you are doing it with intention and with your heart, but you also don't deserve for any administrator or system to try to take advantage of that because it is a
Educate
career. So we deserve certain things.
a hospital pretty close to where I'm at. Whenever COVID happened, they were working all these hours. They were working all of this overtime. Well, when the federal money came in, the ARPA money and such,
Mhm.
what I would view as an opportunity to increase staff wages or to give them a bonus or to buy more equipment, Instead, the CEO, the COO, and a couple of other people gave themselves nice fat checks. And to hell with the people that were on the ground.
Yep. I was in Queens during COVID, and you can imagine how hard we were hit. And you want to talk about the power of a paramedic and EMS. At that time in New York, they were deciding who actually went to the hospital. You want to talk about triage. They were making decisions like, and I'm talking about decisions like they can't save you, like really gut-wrenching decisions. But I was working night shift at the time, and it was like, okay, thank you for the extra respirator or two or ventilator, but we only have one person in the entire department who's qualified to put somebody on a ventilator, and there are four people who need it at the same time. How about you hire a few more people? That would never happen. Um, yeah, it's kind of nuts. It really is. And that's part of what we have to do. We have to counter that. We have to be the human element. Like, people are coming in there. We're the ones that have to advocate for them. We're the ones that have to fight the machine. There's people that I treat, and I know you do too, who would slip through the cracks otherwise. And you have to go the
Oh,
extra mile and say, no, not this person. Like this needs. I mean, you want to talk about you had a tiff with a physician. I once told one who was it was ICU, and they just would not take the patient up, and she's after several hours, she's really decompensating, and uh, not responding well to treatment. And the physician came down again to check on the patient and asked me for an update. And I said to him, "Look, if you don't take this patient up now, they're not going to make it, and I'm going to throw you under the bus in my notes." And they took the
yeah.
patient up, and it's very, I had to get like that. But that's you almost have to become obsessive, like you as a paramedic or me as a nurse. You've got to be a patient obsessed. That's a term that my wife's company uses. She's a businesswoman, but that is, or they not patient obsessed. They don't say customer obsessed, but you have to be patient obsessed in this field, because if you're not, you're going to miss something. And it's not okay to just go with the status quo sometimes and say, yeah, I could, we'll just outpatient that. Or you really sometimes have to go against the grain.
Well, yeah. And so it's no different with us. Like when we call a STEMI alert, well, and then the
Would you
doctor
say a what
disagrees.
alert?
STEMI alert.
Oh,
So someone having like a massive MI.
okay.
If you like, we'll call that in, and then the cardiologist will come down and be like, I don't see any elevation. Well, it's there, and I'm telling you, it's there. I can freaking see it. I know how to read an EKG. They're like,
Yeah.
well, I don't know if I want to be a cath. I'm like, look at this guy. He's pale. He's cool. He's translucent. He's diaphoretic. Classic symptoms: chest pain, shortness of breath, nauseated, vomiting, significant cardiac history. He's already got 6 stents. Why not take him and do an exploratory cath? I guarantee you're going to find something. Sure enough, he had a widowmaker.
Oh, Widowmaker. Yeah. Oh, wow. I'll ask you one more thing. Because I'm having a good time with you, Jeff. I don't want to let you go, but I know you have to. One more question. What is your favorite types of patients? Like, some people respond, they love cardiac or respiratory. What are I guess what are you most comfortable with in terms of a patient interaction?
Honestly, and I'm okay with all of them. I enjoy treating all of them. I don't have anything specific that I like treating any more than the other, except for maybe, and this is going to sound crazy. This is going to sound crazy, like because a lot of people wouldn't agree with this, but I enjoy treating people who are in active drug addiction. Um, that's not
I
your
can see
typical
the
answer.
people. I mean, your people skills are in the most demand many times. That's not something you could. That's not black and white writing on a piece of paper. You really have to get involved in that.
And so it's one of those things where, like, so if you arrive at their side, usually somebody is there. Like we get a lot of response from the fire department and from law enforcement, and most of them carry Narcan. And so they will have sometimes given the patient Narcan, which is a higher dose than what I would give. Like my goal with Narcan is um, to keep their respiratory drive intact. That's all I want. I don't want to wake them up because you know what? They're having the time of their life. That's cool. Like that's not far be it from me because I know withdrawal hurts.
Yeah.
But oftentimes they're awake when we get there because law enforcement or somebody has administered Narcan or they're not far enough into the overdose process to have, to not be able to respond to a smaller dose of Narcan, and so they'll wake up. And I've seen time and time again, and you know, people treat them like they're, scourges of society,
Yeah, they do.
and like not worthy of compassion, and they're not worthy of care. And I know you've heard this. There's this old mentality, an old wives' tale that if you give Narcan and you wake somebody up, they're going to fight you after they vomit.
Uh,
That's not exactly true. Let me ask you this. I'll ask you this. So if you were this gentleman and you were asleep, and all of a sudden you're wide awake and somebody's in your face and they're demanding to know what you took, don't
yeah.
say hello. Don't say I'm a paramedic, I'm a nurse, whatever. What did you take? And they look at you all judgy like that. What's your knee-jerk reaction going to be?
Yeah, I know what you're saying.
Because mine's going to be wrong house, buddy.
Yeah. No, I get
But
what you're saying. Which is funny because that's like such a community health thing, and you're literally in the community. 'Cause you you're at their place. Like look around, like what's going on with them? They may not be ready for a Q and A at the second they wake up.
usually what I'll say is, "Hello, I'm Jeff. I'm a paramedic. How are you feeling?" And
That's good.
usually they'll look, I feel like shit. Well, yeah, and you treat them like they're humans. And that's what I feel like we do a really piss poor job of that sometimes. I think that
Yeah,
we
we do. So a lot, some of that's generational too, Jeff. Some of it, I've noticed a lot of newer people, that's not their forte, shooting the breeze. Even after COVID, for probably a couple of years, I noticed that it seemed like providers, higher echelon providers, are coming in and out of the room a lot because they weren't, especially if they were training during COVID and had became independent, like they're used to just coming in, checking in, say how you doing, and then leaving. I think it's gotten a little bit better now. Things are kind of getting a little bit more normal, but I noticed that as well. But I think that's a generational thing too.
I would agree. I would agree. Or, you get with it's the same as anything else, right? You get with the wrong preceptor, and if they're negative, you're going to get
Yeah.
that negativity. If they treat people
Yeah.
like crap, guess what? Treat people like crap because that's what you know. So
There was in the Navy you get like a buddy for a certain amount of time. And I remember I can't remember the statistic, but like the the percentage of somebody uh, you know deciding to just be ordinary and not go to not do the best they can be, or even to just drop out at some point, rises exponentially based on a crappy preceptor or buddy. It's just like the person who teaches you. I had a woman named Candace in a step down ICU, and she was so serious about documenting what was happening, what you were going through, being specific, and it just set the tone for me. But yeah, that's why also you'll see sometimes I'll see more and more. I'll see like a nurse who has like 1 or 2 years being the preceptor for another nurse, because for a new nurse, because we simply just don't have the staff. That's another problem.
for sure, for sure. We don't have, nearly as long a preceptor process as you guys do, but even still, like we'll have students that, come on and people will ask all the time, like, "Hey, can I come ride with you?" So this is something that I really love, and this kind of goes back to the whole TikTok thing and like social media. There was a young lady that asked me here a while back in a message. She was like, "Hey, can I?" She's from the other side of the state. like 6, 7 hours on the other side of the state. She was like, "Can I do a ride along with you? Like, can I like maybe work out a contract with my school so that you can precept me?"
Pretty
I was
amazing.
like, "I mean, we could talk about it, sure. Like, that's fantastic. That's like the greatest compliment you can ever get."
Yeah. Will you be my teacher? That's what she asked.
And if I'm negative to with patients, she's going to get that. But I
Yeah.
think she knows that I'm a guy, and so there are a couple of them that are like, "Hey, I'll come ride with you." Like,
More,
"Hey, come
more
on,
like
man."
coach. More like coach. That's really what you are to her. That which is way beyond being a teacher. It's being a role model.
Never thought I'd ever see myself as a role model. I had a guy in the EMT class
Get
a
old
couple of
enough.
years ago. We were in the EMT class, and he was like, "I want to be just like you," and I was like, "Bud, you really need a better role model."
Yeah,
Uh,
it's funny. Yeah, that's that means you're doing something right.
I'm hoping I keep doing it right.
So again, your handle is Redbeard the medic. I don't want to say the Redbeard medic. It's Redbeard the medic. Your information, you'll appear. I'll have your information appear on my description. And Jeff, it's been an honor. Thank you so much for coming on my podcast, witnessing me triple over my words. I'm trying to get better at this. I want to talk to you so bad. I want to make sure I ask the questions that I need to ask. But you know, yeah, this is what it's all about for me. This is why I'm doing it. You were the first person I saw on TikTok that had any traction with me. Like, who is this guy? He keeps popping up. Uh, just sitting in your chair, like almost like a rocking chair, I think. So on some porch or something, talking about your discontents, and I'm like, I'm not a paramedic, but they were so spot on to what I'm feeling. It's so universal, I think, what we're all going through. And but thank you for that. And thanks for I think you definitely you definitely set a standard for anybody becoming a paramedic. You should be proud of yourself.
I appreciate that, and thank you for having me on the podcast. I enjoy these conversations, like all across healthcare. This is what it's all about, right? Like we have to understand each other. We see each other, like we know what we go through, and a lot of people don't understand that. But this is like great conversation. I love talking about the job, and this has been a fantastic conversation. I would love to do it again sometime.
You're a perfect me too, by the way. But you're a perfect example of, we work in a system. The system doesn't always put people first, but we do. And I'm old school, and I think the people are more powerful than any system, and the people are the ones that force that system to change. So it's not worth having an attitude like a defeatist attitude that you'll never be able to make a difference, or that no one's hearing what I have to say. It's like, you know what? Find the people who want to listen, find the people that you can affect, and form that alliance and form that team, and just never stop voicing your concern, trying to think of a better way to do something, because that's how we do change the system.
Absolutely. There are people all across the board in healthcare, in any job, that aren't happy with the way things are, but they are unwilling to do anything because they've been conditioned to believe that it's never going to change.
Exactly.
And of course, it's going to change because if the wheel's not squeaking, nobody's going to know to grease it. So
And when you're 22, 23, a new grad, or 18, 19 in the field, you're an EMT, the world does seem very intimidating. And there is a sort of maybe I should know my place, but pay attention to people if you're in that stage of the game. People like you, listen, hear what they have to say. Try to connect their words to what you're seeing, and in due time, just remain curious, and don't give up, and don't think that you're insignificant.
absolutely, because eventually you're going to be the one that's replacing me. And
Yes.
if I am the last voice of reason for EMS, then we are all in a world of trouble.
Yeah, well, thank you so much, Jeff. Again, I look forward to your videos on TikTok and Instagram. And do you have a YouTube channel as well?
I do. I haven't gotten it up and going yet because it doesn't really have any traction yet. But as soon as I get some followers and start putting out some long form content, um, there's all kinds of things that we're working on. We're actually working on merchandise too. I never thought that would be a thing either. So
Oh, really? Yeah, I can see that too. And you definitely, as a paramedic in the field, I could see a lot more. I see logos and phrases and just your 2 cents. I could see you marketing that. That's something that I'm thinking about down the line. I'm just not there yet. I need to find my voice here and build people's trust. But that one of the reasons why I'm so honored that I got your attention in some way that made you want to come on here. It's really terrific. I definitely want to talk to you again in the future. But TikTok, you would say, is where kind of your hub right now.
yeah, TikTok is my hub right now. If something changes, then we'll shift it probably to Insta and Facebook. And YouTube. I really want to get that YouTube up and going because there's some long form stuff that I want to do. There are some classes that I want to do. Um, I'm trying to
With
submit
you,
some
I
things.
feel like the long form, if you would have a camera on, see, I can't do that in the hospital. Until you get the patient, I could see just like just on the road or receiving the call. I could see that. That would be really interesting to see.
We'll do a lot of that. We're working on some education stuff. Um, I actually am going to use that YouTube to teach some classes that I can then submit to different conferences and stuff. Because one of the things that I'm doing is just real quick, it's a
Yeah, yeah,
how we
please.
treat. So like kind of what we were talking about with the addicts. There's a way to treat people. There's this book that I read several years ago. It's by Tom Dick. It's called People Care. Um, it's one of the most fantastic books that I've ever read. It's all about how you treat people and how, yes, you're treating their symptoms and you're treating their diseases, but you're also treating the human condition, especially when you're,
Such an important element. Such an important element.
and we forget that. So that's one of the things that I'm trying to work on is some
Yeah, you need to get on
conference
the
call.
national stage, and it's a national conference with paramedics or whatever it is. You need to be the face. I can tell. You got it. You
Appreciate
got
that.
to.
I really
You're very honest, very upfront, very tough, very trustworthy. Your profession needs you. But
well,
hey, listen, thank you so much. We'll be in touch, and yeah, Redbeard the medic, check him out. Thank you very much, Jeff.
thank you so much. You have a good night. Be safe. We'll be talking in the future, I'm sure.
Yeah, you too. Well, that concludes my conversation with Redbeard the medic, aka Jeff. I hope you enjoyed it. I certainly enjoyed having that conversation. Just a reminder to please like, share, and subscribe and comment. And if you want to follow me on Instagram, I'm at nurse.dad. Also, my website, mynursedad.com. Please give it a look see. Click the YouTube icon. YouTube is pretty much my main hub. It's where I put all my long form videos, my shorts, and my clips. Best way to get to know me is on YouTube and at mynursedad.com. Thank you so much. I really appreciate your ear or your ears. I do think more than one person watched the video. I'm not that popular, but I do think more than one. So thank you for your ears. This is really what is all about, having a conversation, promoting people who are just trying to do the best that they can. All right. Well, without further ado, I think it's time for me to go. So stay hungry, be humble, Nurse Dad out.